Emergency medical services clinicians work on the front lines of healthcare. You see them responding to 911 calls and taking the critically ill and injured to the hospital. Over the last century, the role of these healthcare professionals has evolved into much more as they deliver evidence-based medical care that impacts millions of lives every year. While most clinicians work in ambulances or as first responders, some provide care in other settings, from helicopters to hospitals to house calls. Serving in EMS is an incredible opportunity to care for your community at the intersection of healthcare, public health, and public safety. The journey to become an EMS clinician begins with an educational program. The National EMS Education Standards provide guidance for curriculum development and prepare EMS clinicians to deliver care in any setting. Just like their colleagues in other healthcare professions, EMS clinicians learn in the classroom and through hands-on clinical experience. There are 4 national certification levels for EMS clinicians. EMRs are typically trained to provide immediate life-saving care until more advanced EMS or hospital-based treatment is available. EMTs receive additional education to better assess patients and make treatment and transport decisions. EMTs make up the majority of clinicians in EMS systems across the country, serving as first responders, staffing ambulances, or working in hospital emergency departments. The education of advanced EMTs is comprised of additional coursework and includes more clinical and EMS field experience, preparing them for advanced skills such as starting IVs and administering limited medications. Paramedic education is much more extensive, providing a strong foundation in anatomy, physiology, and pathophysiology. This allows them to better assess and provide the most advanced care and treatment. Paramedic education requires well over 1,000 hours of classroom, clinical rotations, and field internship experience. The process of becoming an EMS clinician doesn't end with successful completion of an EMS education program. Most states require aspiring EMS clinicians to pass a certifying exam consisting of a written test and skills assessment. While states determine the standards for EMS clinicians, many require certification by the National Registry of EMTs, the nation's EMS certifying organization. Like doctors, nurses, and other healthcare providers, EMS clinicians must also be licensed by the state in which they practice. Though guided by the National EMS Scope of Practice model, the states determine the scope of practice for their EMS clinicians, clarifying which medications can be administered and which procedures performed. Credentialing is the final step before someone can practice as an EMS clinician. Whether serving as a first responder in a fire department, an EMT on an ambulance, or a critical care paramedic in a helicopter, EMS clinicians typically provide care under the authority of a physician medical director. The medical director, local jurisdiction, or individual organization should have processes in place to ensure EMS clinicians are both clinically competent and familiar with local policies and procedures. Then, it's time to get to work. Being an EMS clinician in any of these roles and in any setting means working as part of a team and making a real difference in people's lives. Through continuing education, training opportunities, and new certifications, EMS is a profession of lifelong learning and continuous improvement, focused on the goal of providing people-centered, evidence-based care. The hard work of EMS leaders and national organizations has resulted in a process that assures that the EMS clinician who shows up to help is competent, capable, qualified, and caring. Serving as an EMS clinician requires dedication and commitment, but serving one's patients and community at their time of need is an experience that can't be matched.